Good evening, dear students. I am Dr. Ami Rawal, your original guru for dental anatomy and dental histology. Today, we will be discussing the most important MCQs of dental anatomy and dental histology to ace your NEET MDS exam. And this MCQs will provide an insight into the most important topics. So, let's start with the discussion. Coming to the first question. Supernumerary tooth is due to defect in which stage of tooth formation? So this question is from, again, the most basic topic of dental histology, that is tooth development. So our options are, is it initiation, morphodifferentiation, histodifferentiation, or apposition? Supernumerary tooth means extra tooth, extra number of tooth. So, answer here is initiation. Now coming to the answer, why is it initiation? What is initiation? These are the physiologic stages of tooth development. In tooth development topic, we have discussed the stages of tooth development. They are morphologic stages as well as physiologic stages. Which are the morphologic stages? Bud stage, cap stage, bell stage, early bell stage, or advanced bell stage. While our physiologic stages are initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. So initiation means starting, right? So basically, how does the tooth development start? Without the interaction of epithelial and ectomesenchymal tissue, there will be no formation of dental lamina. So, what is initiation? Initiation is interaction between epithelium and ectomesenchyme. It is basically the interaction between epithelium and ectomesenchyme leading to the formation of dental lamina. And this dental lamina plays an important role in formation of enamel organ of primary as well as permanent tooth. So what is initiation? It is mainly epithelial mesenchymal interaction. It is mainly epithelial mesenchymal interaction. And because of this interaction, we get what? Dental lamina. Dental lamina formation takes place. And dental lamina is basically involved in formation of enamel organ of deciduous and permanent teeth. So if there is lack of initiation, absence of initiation, then there will be no formation of dental lamina, and indirectly there will be no initiation for tooth development. So there will be absence of teeth. There might be absence of single teeth or multiple teeth or complete absence of teeth. Complete absence of teeth is anodontia. So lack of initiation leads to absence of either single teeth or multiple teeth. Now coming to abnormal initiation. Abnormal initiation means there is no absence, there is proliferation, there is interaction between epithelial and ectomesenchymal portion, but it is not particular, it is abnormal, leading to formation of extra tooth germ, right? So it leads to formation of single or multiple supernumerary teeth. Which are the supernumerary teeth? Supernumerary teeth, mesiodense, paramolar, right? Mesiodense and paramolar are the supernumerary teeth. Mesiodense are usually conical shaped teeth present between two central incisors. And which are the most commonly missing teeth? Maxillary lateral incisor, our third molars, and mandibular second premolars. Now coming to aberration in initiation. It results in tooth developing in abnormal location. In abnormal location means away from the oral cavity. It doesn't develop in the oral cavity. It develops in some other location such as ovary. For example, it can develop in ovary. If there is disturbance in histodifferentiation stage, it might be due to vitamin deficiency. Vitamin A deficiency leads to what? Poor differentiation of amyloblast cells. And we all know that for dentine formation, inner enamel epithelial cells provide signals, and if amyloblasts are not properly differentiated, they will not provide proper signals for differentiation of dental papilla cells, which form odontoblasts. So if odontoblast cells are not properly differentiated, then atypical dentine will be formed, and this atypical dentine is known as osteodentine. So due to vitamin A deficiency, amyloblast cells fail to differentiate properly, and as a result of which odontoblasts fail to differentiate properly and form osteodentine. Now coming to difference as compared to histodifferentiation, morphodifferentiation stage. So what happens in morphodifferentiation? Shape of the crown is determined, right? So if there is a disturbance during morphodifferentiation stage, it mainly affects the form and size of the tooth without impairing the function of amyloblast or odontoblast. In histodifferentiation, what we have seen? It impairs the function of amyloblast as well as odontoblast, as a result of which atypical dentine was formed. But here, in case of morphodifferentiation, form and size of the tooth is affected. We can have pack-shaped laterals, screws, driver-shaped incisors. In congenital syphilis, we have seen, right? So, twinning may be seen, similar teeth development from tooth germ, splitting of the tooth germ, fusion of the teeth. This can be because of disturbance in morphodifferentiation. Disturbance during apposition. What is apposition? Apposition means formation of dental hard tissue, deposition of dental hard tissue. So if there is disturbance during this stage, consists of two parts. First, formation of organic matrix, and next is mineralization or maturation. So if there is disturbance in matrix formation, then hypoplasia of the teeth will be present, and if there is a defect in mineralization, then hypocalcification or hypomineralized tooth will be seen. So we have seen mainly the clinical considerations for the tooth development. So supernumerary tooth was defect because of abnormal initiation, and lack of initiation leads to anodontia, absence of teeth. Now coming to our second question, which is from enamel. Concentric dark bands or lines present in enamel. Here you can see these are the dark lines which are present in enamel. These are concentric lines. Which are the concentric lines? Are they striophragzias, Hunter-Schreger bands, imbrication lines, or neonatal lines? These are mainly striophragzias. Why striophragzias? What are striophragzias? So we will discuss. Incremental lines of phragzias. What are they? They appear as dark band, brownish band in ground section. They mainly illustrate what? Incremental deposition of enamel, rhythmic deposition of enamel with period of activity as well as period of rest. In transverse section, they appear as concentric circles. These circles resemble what? Growth lines in trunk of tree. These concentric circles resemble what? Growth lines in trunk of tree. Growth lines in trunk of tree. These concentric circles mainly represent growth lines seen in the trunk of tree. Now, sometimes these incremental lines may broaden. There may be distance between the incremental lines. Why? Because of prolonged period of rest, which occurs due to some metabolic disturbances at the time of matrix formation. Metabolic disturbance. So, what are incremental lines? They depict what? Incremental deposition of enamel with period of activity as well as period of rest. If period of rest is prolonged, then there will be broadening of incremental lines, which appears mainly because of metabolic disturbance at the time of matrix formation. Here we can see striae of Retzius. They appear concentric ring-like circles, mainly seen in transverse section, and they resemble growth lines in trunk of tree. Now, what are Hunter-Schreger bands? Here we can see these are light and dark bands. They appear because of change in direction of rods. It is mainly an optical phenomena. Prisms, when they are cut longitudinally, they produce what? They produce dark bands, diazones. These dark bands are known as diazones. Prisms which are cut longitudinally produce dark bands which are diazones, TD. And when the prisms are cut transversely, they produce light bands known as parazones. Angle between, this is again an MCQ question, angle between the diazone and parazone is 40 degree. It is 40 degree. This can be asked as an MCQ question. Angle between the parazone and diazone is 40 degree. Coming to perikymeta. What is perikymeta? It is mainly external manifestation of striae of Retzius. It is a surface structure. They are transverse wave-like grooves, believed to be the external manifestation of striae of Retzius. Here we can see these are wave-like structures believed to be external manifestation of striae of Retzius. What are they known as? We had an option here, imbrication lines. So don't get confused. What are imbrication lines? I don't know what is imbrication line. It is the other name for perikymeta. They are also known as imbrication lines of Becquerel. Imbrication lines of Becquerel. Perikymeta are imbrication lines of Becquerel. Now coming to neonatal line. Neonatal line. It is an accentuated incremental line of enamel. Accentuated incremental line of Retzius. Of enamel on Retzius. It mainly depicts the enamel form before and after the birth. It separates the enamel form before and after the birth. Results from what? It results from disrupt change in environment and nutrition. It develops from change in environment and nutrition. So what is the reason of development of neonatal line? Because of change in environment and nutrition of newborn. In which state neonatal line is seen? In all the deciduous state and first permanent molar. Neonatal line is seen in all the deciduous state and first permanent molar. This line is our neonatal line. This line is our neonatal line, separating the postnatal and prenatal enamel. So we have completed with our second question. Along with, we have discussed all its options. So concentric dark bands are mainly striae of Retzius. Now coming to our third question. Common type of cemento-enamel junction is it sharp junction, overlap junction, gap junction, or all of the above? It is mainly overlap junction. Why? In this diagram, you can appreciate in 60% of the teeth, we can have overlap junction. Here you can see cementum overlapping enamel, right? In 30%, it meets at a sharp edge, edge-to-edge junction. Edge to edge junction means where the enamel ends, the cementum starts at that point. It doesn't overlap the enamel. While in 60% of the teeth, cementum overlapped enamel. And 10%, as you can see here, there is a gap, right, between enamel and cementum. So 10% we have gap junction. In 10% of the teeth, we will have gap junction. So most common is edge to edge, obviously. So what is the reason for the overlap junction, for the gap junction? Edge to edge, it's normal. Formation of cementum starts when, so it is normal. But overlap and gap, what is the reason behind overlap junction? In overlap junction, what will happen? This is the crown of the teeth. It is usually covered by reduced enamel epithelium. This is reduced enamel epithelium. Reduced enamel epithelium. So this reduced enamel epithelium retracts at the cervical portion of the crown. So sometimes it retracts here. So if it retracts, then our enamel will be exposed to dental sac cells. Dental sac cells come in contact with the enamel at the cervical portion of the crown. And if it comes in contact with the enamel, then this dental sac cells will differentiate into cementoblast cells and form cementum. So here cementum will be formed at the cervical portion of the crown, overlapping the enamel. So it occurs because of reduced enamel epithelium retraction at its cervical termination, permitting the connective tissue, that is our dental sac, coming in direct contact with the enamel surface, right? So overlap junctions mainly because of retraction of reduced enamel epithelium at the cervical portion of the crown, because of which the connective tissue cells, that are our dental sac cells, come in contact with the enamel and they differentiate into cementoblast cells and form cementum. Right? Now coming to our gap junction. Why this gap is present? Usually in cementum formation, what is involved? HERS. HERS. What is the full form of HERS? Hurtwitz epithelial root sheet. Hurtwitz epithelial root sheet plays an important role in root formation. So, there will be break in Hurtwitz epithelial root sheet, as a result of which the dental sac cells come in contact with the formed dentine and they differentiate into cementoblast and deposit a layer of cementum. But in case of this gap junction, there is delay in break of Hurtwitz epithelial root sheet. Delay in break of Hurtwitz epithelial root sheet, right? There will be mainly delay in break in Hurtwitz epithelial root sheet. So dental sac cells cannot come in contact with dentine and form cementum. So there will be no formation of cementum until there will be break in Hurtwitz epithelial root sheet. So we have reason for both gap junction as well as overlap junction. And in very rare cases, we can also have enamel overlapping cementum. So please remember, for gap junction, there is delay in break of Hurtwitz epithelial root sheet, and for overlap, reduced enamel epithelium retracts or degenerates, as a result of which cementum is deposited. Now coming to our dental anatomy question. Mesial marginal developmental groove is present in which of the following teeth? Is it maxillary first premolar, second premolar, mandibular first premolar, or mandibular second premolar? This type of questions are commonly asked. Please remember the grooves. They are very important. Mesial marginal developmental groove is mainly present in permanent maxillary first premolar. In permanent mandibular first premolar, we have which groove? Mesiolingual developmental groove, right? And in maxillary second premolar, we have mainly supplemental grooves. Supplemental grooves are more as compared to maxillary first premolar. For permanent second premolar, we have supplemental grooves, and palatoradicular groove is present mainly in maxillary lateral incisor. So this mesial marginal developmental groove present in permanent maxillary first premolar extends from where? The occlusal surface, crossing the mesial marginal ridge and extending to the crown halfway. In this diagram, we can appreciate the mesial marginal developmental groove crossing the mesial marginal ridge and extending towards the contact area. In root portion, we have mesial developmental depression also present on the mesial surface of maxillary first premolar. This is mesial developmental depression. And this is our mesial marginal developmental groove. It crosses the mesial marginal ridge and extends towards the crown of the tooth. This is the occlusal surface. Two cusps are present, buccal cusp, lingual cusp. Lingual cusp is 2 mm shorter than the buccal cusp. This is the tip of the buccal cusp. This is the tip of the lingual cusp. These are the cusp ridges, right? Mesiobuccal cusp ridge, distobuccal cusp ridge. This is buccal triangular ridge extending from the tip of the buccal cusp towards the central groove. And this is our lingual triangular ridge. This is our central developmental groove. This is mesiobuccal developmental groove. This is distobuccal developmental groove. This is distal marginal ridge. This is mesial marginal ridge. Mesial marginal developmental fossa crosses the mesial marginal ridge. Here we can see formation of triangle, and here also. So this is distal triangular fossa and this is mesial triangular fossa. And this is our main central groove. Now coming to the next question again from dental anatomy. Identify the given tooth. So which tooth is this? How many cusps are seen here? 1, 2, 3, 4 and 5. So mainly there are 5 cusps. 5 cusps are present in which tooth? Maxillary first molar has 4 cusps and 1 supplemental cusp which is present lingual to the mesiolingual cusp. So here it is not seen. They are proper well developed 5 cusps, right? So 5 cusps are present mainly in mandibular first molar. This is mesial surface, so this will be mesiobuccal cusp, this will be distobuccal cusp, this will be distal cusp, this will be mesiolingual cusp and distolingual cusp. So this is definitely mandibular first molar. Now side determination. Mesial surface mainly towards the midline, right? So this will be our left first molar, permanent mandibular left first molar. Side determination you have to do on the basis of mesial surface facing the midline. If we place this tooth here, then it will be opposite, right? So it is mainly of left side. Here we can see in this diagram also, we have mesiobuccal, distobuccal cusp and small distal cusp, small rudimentary distal cusp. Coming to next question. Type of collagen present in von Korf's fibers. Is it type 1, type 2, type 3 or type 4? It is mainly type 3. What are this von Korf's fibers? They are mainly present in mental dentin. Mental dentin is present just next to the dentino-enamel junction. Mental dentin is composed mainly of type 3 collagen fibers which are agrophilic, that is they stain mainly with silver stain. Silver stain. So they are mainly agrophilic and they are known as von Korf's fibers. This type 3 fibers present in mental dentin are von Korf's fibers. They are larger diameter fibers and they are usually perpendicular to the dentino-enamel junction. They are present at right angles, perpendicular to the dentino-enamel junction, and after which the fibers laid down will be parallel to the dentino-enamel junction. So this von Kopf fibers are only perpendicular, the rest of the fibers will be mostly parallel. And von Kopf's fibers are large diameter fibers. They can be stained with silver stain, argyrophilic. They have corkscrew appearance. In this diagram, you can see perpendicular fibers. These are von Kopf's fibers. Corkscrew appearance in sections stained with silver. Now, this is again a very important question. Chronology should be on your tips. You should be thorough with the chronology of permanent tooth as well as deciduous tooth. Any question can come from chronology. You can be asked about eruption time of any tooth. You can be asked about the root completion of any tooth. Even the calcification, you can be asked. Calcification of permanent first molar takes place at, so it is usually at birth. So this question, it is basically on the eruption timing. Which teeth start erupting at 10 to 12 years of the age? Maxillary first premolar, maxillary second premolar, mandibular first premolar, or all of the above? Correct answer is all of the above. All of the above. Why? Here in this chart, you should be thorough with this chart, right? Permanent first premolar maxillary. Eruption timing is 10 to 11. So 10, starting from 10. Okay, this is our one option. It is correct. Coming to maxillary second premolar, it is again 10 to 12. It is also correct. And coming to eruption timing of mandibular first premolar, it is also 10 to 12. So all the three options are correct. So please, you should remember this eruption sequence, eruption timing, not only for permanent, also for deciduous tooth. You can be asked, first teeth to erupt in the oral cavity is calcification time of first molar. These are the most commonly asked questions. Eruption timing of canine. Now coming to again dental histology question. Which of the following are pressure receptor cells in oral mucous membrane? Pressure receptor cells. Is it melanocyte, Merkel cell, Langerhans cell, or keratinocyte? Melanocyte mainly produce what? Melanin, right? So this option is incorrect. These are mainly non-keratinocytes. These three cells are mainly non-keratinocytes. They constitute about 10% of the cell population in oral mucous membrane. So these three cells only are non-keratinocytes. Keratinocyte mainly produces keratin. Then our option is Langerhans cells. Langerhans cells are mainly antigen presenting cells. They have immunologic function. So this option is also wrong. This option is also wrong. They are mainly what? Langerhans cells are antigen presenting cells. Immunologic function. Logic function. They have immunologic function. So Langerhans cells is also cut. Remaining is Merkel cell. Merkel cell is basically our pressure receptor cell. It is present in the basal cell layer close to the nerve fibers. So our option Merkel cell is correct and remaining are not correct. Which of the following are pressure receptor cells? So correct option is Merkel cell. Melanocytes produce melanin. Merkel cell is specialized neural pressure sensitive receptor cell and it responds to touch sensation, mainly touch sensation. Keratinocytes produce keratin. Langerhans cells are have immunologic function, mainly antigen presenting cells. They identify the antigen, engulf them, and then they transport to the T lymphocytes. Melanocytes and Langerhans cells are mainly clear cells, but Merkel cell mainly constitute desmosomes and tonofilaments, as a result of which it is not dendritic and hence it doesn't appear clear. In two-digit tooth numbering system, 3 refers to. So first of all, what is two-digit tooth numbering system? It is FDI system, Federation Dentaire Internationale. It is mainly FDI system. So don't get confused if it is asked two-digit tooth numbering system. It is FDI. So what will be the right answer? Is it permanent maxillary left canine, permanent mandibular left canine, permanent maxillary right canine, or permanent mandibular right canine? This is our FDI system. And what is our question? 3. In FDI system, they are saying it is a two-digit system. So here we can see 3. It is mainly left quadrant and mandibular. So mandibular left canine is our correct option. Mandibular left canine is our correct option. Why? Being a two-digit system, first digit represents what? Quadrant. Whether it is right or left or maxillary and mandibular. So quadrant. Left or right and arch. Maxillary or mandibular. And the second digit represents what? Tooth number, particular tooth in a given quadrant. Second digit represents what? Tooth in the given quadrant. So for permanent teeth, FDI system has first digit 1, which is for maxillary right quadrant, 2 for maxillary left quadrant, 3 for mandibular left quadrant, and 4 for mandibular right quadrant. So these are our first digit representing the quadrant, being right or left or maxillary or mandibular. Now comes our second digit, that is tooth. If it is 1, then it is central incisor coming to 1, 2, and we don't spell it as 11. It is 1. It is 1, 2, not 12. It is 1, 2. So here we are saying 3. Right? So up till 8. Central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, and third molar. This from 1 to 8 they represent a tooth number. So being a two-digit system, first digit represents quadrant and second digit the tooth number. Now coming to deciduous tooth. Here the quadrant numbers are changed. They are starting from 5. 5, 6, 7, 8. 5 for upper right, 6 for upper left, 7 for lower left, and 8 for lower right. And we have central incisor, lateral incisor. We don't have premolars in deciduous tooth. So canine, first molar, second molar. Then we have basically three systems. FDI system we have studied, universal system or Zygmundian Palmer notation. Coming to universal system. Starting from the third molar, the numbering is given. 1, 2, 3, this is our midline. Till the central incisor, we have 8 number. Then again coming to the next quadrant, upper left quadrant. Start with the central incisor, ending with the third molar. From 1 to 16, we have from upper right quadrant to upper left quadrant. Now coming to lower left. Again starting from the third molar to third molar, second molar, first molar, second premolar, first premolar, canine, lateral incisor and central incisor. We have our lower left quadrant. This is right, this is left, this is left, this is right. Right quadrant ending on the third molar. Now coming to Zygmundian Palmer notation. This is mainly a quadrant system or a grid system. Quadrant or grid. Quadrant or grid system. Here this vertical line represents the quadrant and horizontal line represents the arch, right? So this being towards the midline, this will be our right quadrant. This will be our left maxillary left quadrant. This will be our mandibular left quadrant. So this is our maxillary right, maxillary left, mandibular left and mandibular right. So if this is given 1, then it will be maxillary right central incisor. But if the same one was given this way, then it will be mandibular right central incisor. It is same for numbering up till 8, starting from the central incisor towards the third molar. And for deciduous teeth, they are written in alphabets. Same for universal system we have. We will have alphabets for deciduous teeth. So if we have A, then it will be what? Mandibular right central incisor, but this is deciduous. Now coming to our next question, which is our last question for today's discussion. Besides the contraction of secretory unit, the other function of myoepithelial cell is to secrete what? Matrix metalloproteinase, inhibitor of matrix metalloproteinase, proteinase or interleukin. Our right answer is inhibitor of matrix metalloproteinase. Why? What is its function? What are myoepithelial cells basically? Myoepithelial cells are present where? Near the secretory and intercalated duct cells. This is again an MCQ question. They are present where? Here we can see this is intercalated duct and surrounding them we have our myoepithelial cells. So they are present near the secretory and intercalated duct cells. They are mainly stellate or spider-like with flattened nucleus, scanty perinuclear cytoplasm, and long branching process that embrace the secretory duct cells. This appearance is like basket cradling the secretory unit. So they are also known as basket cells. They are known as basket cells. They have stellate appearance. They have spider-like appearance. They can have appearance of octopus sitting on rock appearance, right? Now coming to our question, functions of myepithelial cells. Basically, they accelerate the flow of saliva, reduce the luminal volume, maintain the duct patency. They may shorten and widen the intercalated duct. Secretory pressure, they contribute to the secretory pressure of acini or duct. Support the underlying parenchyma and reduce the back permeation of the fluid. Help salivary flow to overcome the increase in peripheral resistance. It provides signals to the acinar cells and mainly they help in maintaining the cell polarity and organization of acinus. Now coming to our answer. They produce a number of proteins that have tumor suppressor activity, such as proteinase inhibitors and angiogenesis factors, which are barrier against epithelial neoplasm. They produce what? They produce proteins and tumor suppressor cells that act as a barrier against the epithelial neoplasm, which are mainly the proteinase inhibitors. So these are the inhibitors of matrix metalloproteinases, and they also secrete anti-angiogenesis factor. So from this question, we have seen that tooth numbering system we have completed. We have discussed about the tooth development, stages of tooth development, salivary we had a question from salivary gland, right? Then we studied about non-keratinocyte cells. Which are the non-keratinocyte cells? Eruption timing, fibers of dentine, and basic occlusal anatomy of premolar as well as molar. If you have any doubt, you can ask in our Telegram group. We are always there for you. Nice meeting you, and we'll meet soon again. Till then, study, and if you have any doubts, I'm there for you. Good night.